2020 illuminated for all of us the immense need for reliable healthcare. Unfortunately, in Uganda, when the COVID-19 pandemic began, research indicated that there were only 55 ICU beds in the entire country. That's 55 beds for 45 million people. But even before the pandemic, this has been the case for years across Uganda. For decades, the leading causes of illnesses and death have been preventable and treatable. That's issues like AIDS, tuberculosis, malaria, typhoid, respiratory tract infections, diarrheal diseases, maternal and delivery complications. And all of these issues continue to wreak havoc even today. Leading medical institutions around the world state that Uganda's greatest healthcare need is access to reliable medical care. That's both infrastructure and human resources. The average Ugandan lacks basic access to doctors, nurses, health specialists, clinics, hospitals, reliable equipment, medications, and educational services. All services that could meet the physical and emotional needs of Ugandans. And we've seen it firsthand. In the rural communities we partner with, these problems are even more amplified due to their remote locations, rundown facilities, and lack of investment. Families we love, parents, children, grandparents, all unnecessarily suffering. So in 2021, we decided if we were truly going to advance healing, wholeness, and Christ's redemptive goodness into the life of communities in Uganda, then a core component of our model would have to be centered around the adequate healthcare services provided for all. And thanks to you and our amazing team in Uganda, we did it. Welcome to our first medical center in Namayemba, Healing Grace Medical Center, owned and operated by AsOne Ministries Uganda.
Growing up, I lost a friend, a dear friend, my closest friend, to sickle cell disease, just because we couldn't afford to buy blood. From that time on, my dream really changed. I stopped thinking of the engineering that I dearly dreamt of to being a doctor.
This facility started on January 18, 2022, just at its commencement. The turn-up alone proves that there is a problem that has been tackled.
So Ugandans really need the services that we are really providing, because by putting clinics very close to them, we are solving a lot. We are reducing on the death of children. We are reducing on maternal deaths. We are reducing on death from avoidable causes.
We have a holistic mission. So we both help people's needs. Clinic can treat people and people get well. But with that, they can also teach to them the good news, the hope that we have.
All the services we are giving to the people of the community, it's love. By loving and by caring, I actually see us serving Christ.
We couldn't be more grateful for this opportunity to run a sustainable medical center in a community that needed it deeply. Every single day, patients are receiving the care they need to live healthy lives. It's a joy to see how many of you have enabled a vision of Ugandans empowering Ugandans. Ugandans, healthy, alive to Christ, and active in their own communities. By 2025, our vision is to have a medical clinic in each community we serve. It's all a part of accomplishing our dream to end spiritual, relational, and economic poverty, one community at a time. Thank you for joining us for the second episode of Season 2 of The Story.